Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as the social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders from the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.aaai.org. Today's edition of our Conversations from the World of Allergy podcast series is targeted towards the general public, clinicians, and honestly, anyone who cares about asthma, as you'll find out soon enough. Today's guest is Dr. Anil Nanda. Dr. Nanda treats patients in his private practice at Asthma and Allergy Center with locations outside Dallas, Texas. Dr. Nanda is also a member of the clinical faculty at University of Texas Southwestern Medical Center. Dr. Nanda is very active within the American Academy of Allergy, Asthma, and Immunology and was recently elected to serve as a member of the board of directors for the next 4 years. Today, we'll be discussing Asthma Awareness Month, which occurs every year in May. Dr. Nanda, thank you so much for taking time to join us today, and welcome to the podcast.
Yeah, absolutely. I'm really happy to be here, and thanks for having me on. Appreciate it.
No, we appreciate it. And every year May is designated as Asthma Awareness Month, and you do a lot of work in the realm of asthma. So I think you're a great guest for this episode. But why is asthma so important and deserving of its own month?
Yeah, absolutely. I mean, it's estimated that approximately there are about 26 million people in the United States. Probably a little bit more with asthma, and so it affects so many people. Most people have a family member or a friend or a relative with asthma, or they have asthma themselves. So it's a big issue. And in addition, there's unfortunately, and we're trying to prevent this, right, as physicians and the healthcare community in general. But there's fatal asthma. People die of asthma. The Allergy and Asthma Foundation of America estimates approximately 10% of people in the U.S. die of asthma each day. So it's a very, very important condition. Absolutely.
Yeah, I appreciate you mentioning that because I think there's a lot of attention on rare diseases that impact,
Sure.
tens of thousands of people. And something like asthma, it's almost so common that I think people lose sight of the fact that it can be very severe. And as you mentioned, there are fatal asthma exacerbations every day. And, across the board, raising awareness for conditions such as asthma, it's really an opportunity for education, advocacy, and support for those living with various, conditions. Does asthma impact everybody the same way?
Yeah, it's different. It impacts everyone differently. Just like everyone's an individual, right? And so certain conditions affect certain people one way, other people another way. Sometimes it's not as severe with certain patients. Sometimes it is. And it's so interesting with asthma. Anything can kind of trigger it. There's so many different things that can trigger it. Allergies. We're both allergists and immunologists. That can trigger asthma. Even strong emotional states like laughing too hard can trigger it. Cold weather can trigger it. Warm weather can trigger it. So everyone's different, and everyone sometimes their asthma gets worse during the day or when they play sports or sometimes at night. So it is really different patient to patient, and that's something we look at. It's not a one size fits all. So I think individualized approaches are definitely important.
hmm I still hear folks. I see them myself when they get referred, and they're told things like, "Oh, children of a certain age can't have asthma because they're too young when they're like 5 or 6 years old, or something like that, or you can't develop asthma when you're an adult." Are those true at all, or can people develop asthma at any point?
Yeah, they can develop asthma at any point, and a lot of times, and I think this is a great thing we're doing this podcast, for the general public, is there's still a stigma with having asthma. People like to refer to it as different things, and they're like, oh, my child, he or she wheezes, let's say, or has been on, albuterol medicine, a common medicine for asthma. It's the inhaler or nebulizer form. And they're like, well, they don't have asthma though, even though they're treated for it, So definitely there's still a stigma, and we want to reduce that, and asthma is a condition, like many other conditions, just like hay fever. We treat a lot of allergic rhinitis, the nasal or sinus issues. Asthma, is a condition also, and I think it's important to know that it can develop at any point. And I have a lot of adult patients that come in. I see all ages, and from age 0 to 100. My oldest patient I think was born in like 1919. So
Oh,
I have patients, adults come in, and they're like, hey, I've never had asthma as a kid, and I'm having this cough or this respiratory symptoms, but it can't be asthma because I didn't have it as a kid, and that's incorrect. You can develop asthma at any point, and so that's why it's important to see your board certified allergist immunologist for evaluation. Definitely. So.
yeah. Well, can you walk us through a day in the life of someone with poorly controlled asthma? Does this impact their work or school, activities, sleep in any way?
Yeah, absolutely. Pretty much all of the above a lot of times, especially with poorly controlled asthma. Work, they can't go to work every day. They're worried about losing their job. They're missing so much time at work, school, their activities. They can't do their sports, or not even just sports, just daily activities. If they want to take a walk, sometimes they can't do that, or at night they just want a good, who doesn't want a good night's rest, and they're up all night coughing or wheezing or just having shortness of breath, and it's a big issue. So absolutely, it impacts so many just regular activities of daily life. A lot of people say, well, I have asthma, or I have well controlled asthma because it just affects me, if I'm running real fast, or things like that. But no, it affects all different aspects. So it's very, very important to realize that, and we want everyone to have a very full, active life. So definitely, if you have some things that are affected, it's very important to see your physician. Absolutely.
Yeah, and is somebody with poorly controlled asthma, does that make them more prone to need unscheduled, ER visits or visits to their doctor or even hospitalizations? Can asthma make people sick like that?
Yeah, absolutely, absolutely. And sometimes it gets to a point where if it's untreated or unrecognized, people, they go into the ER, or unscheduled visits and things, and it's just a tough thing. And that's what we want to do, as allergists, immunologists, is to try and prevent that, and educate the public about that. To don't, or a lot of times what people do, and you've seen this too, Dave, is people underestimate their symptoms.
Hmm.
They're wheezing, and you can hear them wheezing across the room when you're seeing them in the office, and they're like, well, my asthma's fine. It's fine. I just had to use my inhaler last night, and that was it. And instead of 7 hours of sleep, I got 5 hours of sleep, and it's just a tough thing. So we want to make sure that they are improved, and they see the difference. A lot of times people get used to their symptoms,
Hmm.
and then we finally treat their asthma, and their lungs open up, and they do so much better, and they realize, saying, oh, I never realized I could feel like this. So it's definitely important. Yeah.
No, I'm really glad that you pointed that out because I agree with you. I see so many people that just they think it's normal to feel that way, and then we can actually help them breathe for the first time in a long time, and it makes a huge
Sure.
difference.
Yeah, no, no,
What
absolutely, absolutely.
Yeah, what does well-controlled asthma look like? So you sort of painted the picture of what it looks like when somebody has poorly controlled asthma. Do we have a cure for asthma? And if not, are there medications or different steps that people can take to reduce the frequency and severity of their symptoms?
Yeah, no, definitely. With asthma, it's a condition of inflammation, and a lot of times, and I tell patients like this, just like their nose, right? Everyone, so a lot of our patients get stuffy nose, runny nose, hay fever type symptoms, and that's because there's inflammation in the nose. Kind of the same thing, similar. It's not exactly the same, but similar. With asthma, you have inflammation in the lungs, and that's causing, the breathing issues, and the wheezing and shortness of breath. And so, if someone's asthma is well controlled, that's great. They can do their daily activities fine without having any issues. Um, the one thing about cure, it's difficult to actually probably cure asthma. We try, we're all perfectionists, right? As physicians and allergists, immunologists, we want to cure things, but a lot of times there's a low level of inflammation lying in. So I guess a better way of saying, instead of saying cures, maybe we just say controlled, or as you said in your question, well controlled. Have the asthma under control, And I think, we've seen this so often where patients, they get treated for their asthma, by whoever. Let's say they're allergist immunologist. They get treated for their asthma, and they're like, "Hey, I feel fine. I feel great. I don't have to take my inhaler anymore. I don't have to take my anti-inflammatory inhaler anymore." And then their inflammation kind of builds up, and then suddenly they have symptoms and are back in the emergency room or back in our offices. So I think one thing it's very important, instead of kind of looking at it like cure or not cured, keep it under control and see your physician for follow-up visit. I recommend seeing your allergist immunologist at least once a year. Even if you're doing great with no symptoms, once a year, just to make sure things are going well. I think it's very important to continue that follow-up with your allergy immunology physician.
Absolutely. I think that's a great point. I've heard rumblings of a work group of some of our colleagues who are experts in asthma trying to get together and develop a consensus definition of what asthma remission looks like. Have you heard of this as well?
I've heard of it, and it's difficult. The term remission, and it's almost kind of from our oncology or cancer doctor
Mm-hmm.
colleagues and things. I like the term, better controlled, but remission again is same thing. Is that or similar? It's like it's well controlled, and so it's a great point. That's our goal. Our goal is to have asthma controlled or remission, but the problem is asthma can occur at any time, so
Hmm.
even if it's under well control, let's say you're exposed to, right, it's April right now, and May, of course, is, Asthma Awareness Month. We have, tree pollen and grass pollen coming up. So they're exposed to a lot, asthma can be well controlled, but then boom, they're exposed to their allergen and their asthma can flare up. So I think it's very important to realize that asthma can occur at any point. So just be aware of that, definitely.
Hmm. You sort of touched upon this a little earlier, but what have we learned about the different types of asthma over the past decade or so? And how do you, as an asthma specialist, incorporate that understanding when you're treating patients?
Yeah, no, absolutely. I mean, there are different types of asthma. We talked about allergic asthma. It's called by allergens. As allergist immunologists, we're very familiar with that. Other types of asthma, we say non-allergic asthma. If they're not allergic to anything, the asthma, of course, can still occur. It's so interesting in some patients, who are smoking. Unfortunately, sometimes they have, this what's called COPD or emphysema, and that's associated, sometimes can occur along with asthma. And just a quick blurb, if you're smoking, e-cigarettes, vaping, things like that, you want to stop that, just for general health, but of course to help improve your asthma. So there's a lot of different types of asthma, and we're uncovering so much about asthma. There's even more types that we're going to uncover in the future. But it's almost like everyone's different, right? We say, this is John's asthma, this is, Denise's asthma, Ben's asthma. So I kind of look at it just from an individual perspective with our patients for sure.
Well, and as you described some of the different types of inflammation, now we have a treatment option called biologics, which it really is a highly individualized approach towards treating asthma, which is relatively new in the grand scheme of things. Can you tell us more about these biologics and how they've changed the landscape for people living with severe or poorly controlled asthma?
Yeah, absolutely. I mean, biologics are therapies, usually injection therapies for asthma. They're anti-inflammatory medications with a lot less side effects. A lot of the anti-inflammatory medications, particularly the older ones, can have more side effects. And I think it's important to bring this up now. A lot of times we talk about anti-inflammatory activity or therapies for asthma. We talk about steroids, or corticosteroids, and that's a big buzzword in the general public. They're like, wait, first of all, with the steroids, they're not the same as what bodybuilders use or other like testosterone or anything like that. It's a different type. We call it an anti-inflammatory steroid, and there's different types of them. What a lot of people use, let's say they take like what's called a systemic steroid, like an oral, like a pill steroid or an injection steroid. We want to try and avoid those. I think that's very important because those can have a lot of side effects, lower your immune system, diabetes, bone issues for long term. So we really want to try and avoid those. The inhaled steroids are like, it's almost like the nose sprays or the inhaled, which we use for allergies, for nasal allergies, but for asthma, you have the inhaler type steroids, which are much lower dose and much, much safer. So I just want to point that out to the general public, just kind of the differences. All corticosteroids or all steroids are not the same. But the issue with what biologics come with, or how they came about, was we have a lot of patients with severe asthma where the inhaled steroids are not working as well. So they have to be on so much of these kind of pill steroids or injection steroids, which is just a high amount. And so biologics came about to try and reduce that, where they target kind of different parts of the inflammatory pathway without targeting everything like the systemic steroids do. So biologics have really been a game changer and really helped out a lot of our patients, where they are on the biologic medicine, their asthma gets better. They don't have to be on these kind of high dose kind of pill or injection steroids. So very important. Yeah.
Mm. When I look online for information about Asthma Awareness Month, there's a lot of
Mhm.
discussion about both climate change as well as the environment. Is this some sort of politicized agenda that I'm coming across, or do these things actually impact people with asthma?
Yeah, no, I mean, everything is politicized nowadays, right? But so, but these things, they definitely impact people with asthma. Anytime there's high pollutants in the air, high ozone days, especially in the summer, as we're coming up on the summer
Mm,
months, asthma incidence goes up. And then again, the other thing is there's pollens in the air too, right? So we talked about the different types of asthma, including allergic asthma. Definitely with the high pollens and high pollen counts, that can exacerbate your asthma. It's interesting. They've done a lot of studies with patients who are in urban areas or near roadways, things like that, near interstates, and just
mm.
exposed to a lot of auto exhaust, right? Automobile and motor vehicle exhaust, exhaust and everything, and that kind of inflammation. And they've shown that there's more asthma. So definitely, I think that it's important. The environmental impact of asthma is definitely real. And as a matter of fact, our current Quad AI president, that's one of his, what he's looking at is environmental impacts on asthma and one of his presidential initiatives. So absolutely, it's something that's important and impactful.
Yeah, and thanks for plugging the podcast. For anybody who's interested in hearing more about Dr. Bernstein's initiatives, you can check out our latest episodes of the podcast series with links in the show notes and things like that. But back to
Yeah,
Asthma Awareness Month. So
sure.
you
No,
met
exactly.
you mentioned a couple of common asthma triggers earlier. You mentioned even laughter and exercise and upper respiratory infections. What are some of the other asthma triggers that you help patients identify, and can they be a cause of both acute and chronic symptoms in some cases?
Yeah, no, definitely. I think one thing, we talked about, I touched on earlier, cigarette smoke can worsen asthma for sure, or even secondhand exposure to cigarette smoke, things like that. So just one thing for the parents, a quick thing of if your child has asthma, even if you're a smoker, try and not smoke in front of the kids. Try and cut down yourself for your own general health. But secondhand smoke is a real issue. There's so many other common asthma triggers, the different allergens, all the different pollens, animals. We'll talk about that here in a second, just a little bit, but, there's cats and dogs and things like that. Again, we talked about the environmental triggers that can be emotional states, so many different types that can cause both acute episodes. And then chronic symptoms too. If you're just exposed to an allergen or live near an interstate, something like that, you're definitely or a high polluted area. Everywhere in there's different laws, in the U.S. and around the world where some places just have a high amount of allergens. Or if for example, you're getting your home remodeled. A lot of my patients come in and
Mm,
they're getting their home remodeled, exposed to all dust and everything. They're trying to live at home, they're trying to live while their kitchen's being remodeled, but no, they're exposed to all the dust and they still get allergies. So I would say anything can trigger asthma. So just kind of be aware and ask your physician, your allergist, immunologist. That's what we said. Everyone's under different stresses and different environments. So absolutely.
yeah, and I think that's one of the benefits of what we offer as asthma specialists, right?
Yeah,
There's misconceptions that we just push medications on people or things
sure.
like that. But can you speak to how much of your initial consult visit or follow up visits do you spend actually just talking about the environment that your patients live in? Is that a big part about what you do?
Oh, absolutely, absolutely. It's a big part of the history, and I think one thing that we're very proud of as allergists, immunologists, our specialty is we tend to spend a lot of time with our patients. It's
Mm-hmm.
very very important, and definitely medication is just one part of the of the visit. It's mainly going over the home environment, if there are any pets, what else is going on, if they're smoking, if they're doing anything else, and including where they travel to, right? Everyone's different. Where are they going? Where are they traveling to? What is their commute like to work? Things like that. Everything is so impactful, and everyone has a different living situation, so it's something to definitely keep in mind. And I think just in general, I think just spending extra time and with your patients is really helpful. And one other thing, just talking to our patients here in the general public is just in general, to help us out as physicians, I think, and to help you, just to better help you, is bring in all your medications to the visit.
Mm-hmm.
Bring in all your inhalers, everything that you've used, because that can help us identify what's worked, what hasn't worked, and go from there for sure. Mhm.
Oh, I love that tip. And there's been countless times when people, bring in their bag of inhalers or medications, they
Yeah,
dump them out, and I say, okay, show me which one you use in the morning and at night. And they oftentimes will
sure.
point to their reliever that they're using scheduled as opposed to
Yeah,
their controller, which they're using on demand. So it
sure.
can be very insightful. I love that tip.
Yeah, no,
Uh,
absolutely. Very important. Sure.
I recently read an article that was published in a prominent newspaper. This is actually a little frightening to me. That essentially
Sure.
they listed like a dozen specific products that they advised anybody with allergies or asthma to purchase for their home, and this ranged from $300 vacuum cleaners with HEPA filters to $1,000 plus air purifiers. So, can you help us better understand? Should everybody with asthma incorporate the exact same trigger avoidance measures inside their home, or should this really be more individualized?
First of all, I'm shocked that newspapers still exist, right? I think everything's online, right? But but no, there are some newspapers. I still like printing out stuff and reading it. So no, absolutely. But no, I think it's very interesting. There's so much advertisement, and we're going to get to this later on. But there's so much advertisements and everything online and in print, that there's different things to do, vacuum cleaners, air purifiers, and it's again not one size fits all. I would probably say what I tell my patients is, sometimes air purifiers and vacuum cleaners and things can help out. Sometimes they can't. So what I say is kind of use a basic. There's no one like perfect. There's no ranking list of like perfect, vacuum cleaners or air purifiers. What's best? So I would say just buy if you're thinking an air purifier can help. You can buy a basic one and just see if it helps. All these other ones with bells and whistles, they may not work as well as just a basic air purifier. So definitely I would just get a basic one, and it's something to consider. It's not guaranteed to help the air purifier, so that's why just get a basic one first, see if there's any benefit. Absolutely, and again, individualized. I mean, these they cost different. Every air purifier costs differently, and again, the more expensive one may not work better than the cheaper one. So just be aware of that.
Yeah, no, that's great advice. This same article, I won't dwell on it, but it was frightening. But they even mentioned purchasing dust mite zippered covers for mattresses and pillows for the purpose of protecting mattresses and pillows from outdoor pollen, which I thought was an interesting twist. Where in my mind, I just said, well, just keep the windows closed, and then you don't have to worry about that. But anyway,
Exactly. That's a little cheaper to shut the window, right? I think.
yeah, right.
So.
Now, Dr. Nanda, I want you to set the record straight here. You mentioned earlier that pets, beloved pets, dogs and cats and other animals can be a trigger for people who have asthma, both chronic and acute symptoms. So, do you tell people that they have to get rid of their beloved pets?
Yeah, no, absolutely not. I mean, people will probably get rid of their physician over their beloved cat or dog or whatever they have, rabbit or any, chinchilla. I've had patients with chinchillas, and other kind of animals. So, and pets, they're so popular. There's so many things we can do. Our goal is to help our patients, as allergy immunology physicians, our goal is to help our patients, live their normal lives, without asthma getting in the way. So definitely, having your pets are fine. There's things like allergy shots or allergen immunotherapy we can do to kind of help those of you with pet allergies. So no, I mean that's very very important. You don't have to get rid of your pets, and just see your allergist immunologist, and we can help you out. Absolutely.
Yeah, can you touch upon the latest iteration of the National Heart, Lung, and Blood Institute asthma guidelines? So, our United States National Asthma Guidelines were published a few years ago in 2020, and there was a very specific section on the importance of using allergy testing combined with the clinical history to help guide allergen avoidance measures. And I think that you're kind of getting along those lines. So, tell us more about why that's important.
Yeah, no, absolutely. And I think, there's so many different, when we talk about guidelines and everything, it's important to just, we talk about the shared kind of decision making, basically, and
Mhm.
what the patient, we kind of incorporate what's in the patient's lifestyle, what the patient is looking for, our recommendations. It's not like in the past where the physician's like, hey, you have to do this, this, and this, and that's it. There's kind of no discussion. This is what you do. Definitely now everyone's different. Let's say someone has a pet or someone has a dog or someone travels a lot, things like that. So definitely it's important to incorporate the patient's lifestyle. And again, it's kind of almost a theme, right? It's not one size fits all. You have to individualize therapies and treatments for each patient. So it's important to realize that the patient's lifestyle and where the patient lives, all of this, where the patient works, everything, to look at ways in treating their asthma. Yeah.
Yeah, no, I think that's important. Can you touch a little bit more upon this concept of shared decision making? So, how do you employ that in practice when you have somebody with asthma? Is this in regards to treatment options that may be available or, avoidance measures? Can you expand upon that a little bit?
Yeah, absolutely. Yeah, it's everything, everything involved. From the testing. Let's say, hey, I want to see, what you're allergic to, and there's a skin test, there's a blood test, whatever patient's preference is. It goes to also the different therapies that are available. Some inhaler controller inhalers, kind of we say the anti-inflammatory inhalers. They're very different. Some are dry powder inhalers, some are kind of meter dose inhalers, which don't have that powder kind of taste or things like that. And so sometimes they have a preference in which medicine. Sometimes even they want a nebulized medication, with the kind of, it's that machine, for those of you who don't know the nebulized ones in our public, basically the machine. It's kind of a liquid form of the medicine that we give, and it's kind of smoking kind of thing. It's a big production sometimes,
Hmm.
but it's basically a medication that you kind of use through a nebulizer machine, as opposed to inhalers. And some people, use that instead, or prefer that instead. Or they're traveling a lot and say, hey, I need something that's going to help me when I'm traveling. I'm out of town a lot, or hey, I'm in this. When I travel to my family member's house, they have a cat. Even though I don't have a cat at home, I travel to my family member's house and they have a cat, and I'm allergic to cats. What can I do to help prevent that? And so it's very, very important to kind of incorporate what the patient needs, and according to what they want, for sure. Uh-huh.
Hmm. No, absolutely. Very patient-centered care these days.
Yeah,
Yeah,
absolutely.
I've heard you say over and over again, just in this conversation, that asthma is individualized, that it's different for
Sure.
everybody, and there's different ways of sort of gaining asthma control. Yet at the same time, there are so many people that still suffer from chronic symptoms or exacerbations. So, what are some of the systemic and individual factors that contribute to either lack of appropriate care or non-adherence?
I think it's one of the things, what I've seen so much in my practice is just a lot of asthma is undiagnosed. It's not, a lot of people think about asthma as just shortness of breath, and that's it. They don't realize a lot of my patients come in with cough. They've had this cough and they've been diagnosed at different, they go to the ER, urgent cares, things like that. And they're diagnosed with this kind of bronchitis or an infection. And there's usually not an infectious component with asthma. It's more kind of inflammation. But a lot of times these patients are given a lot of antibiotics and a lot of other kind of inhalers that don't have any anti-inflammatory components, and they come into my office and I'm like, well, the cough that you're having, it's due to asthma. Cough can be due to so many different other things, but a lot of times, it's due to asthma. So a lot of times it's just not diagnosed, and there's a whole host of issues. Sometimes, getting into non-adherence with medications, sometimes the medications are very expensive, and this gets to a big thing just as
Mhm.
physicians in general we're dealing with, is a lot of the medications in general, not just asthma medications, are very expensive. So they're prescribed the medication and the insurance company doesn't cover it, or they're like, well, I may not need this medication. I'm not going to pick it up from the pharmacist. And then, they go and they have, their asthma just gets worse and worse. And so there's a lot of kind of systemic, health issues and equities we talk about in the healthcare system. And I think, the best way, we're trying to do things, I think, as for example, the Quad AI and our, all our physician societies are trying to improve that for sure. But I think as an individual physician, and I have a solo practice, I try and just make sure that the patients are adherent with their medications, talk to them about the importance of taking medications, and trying to find the right medication, trying to find the medication. A lot of times we're just trying to find medications that are covered by the insurance company, by the particular patient's insurance company, and utilizing samples and things to get the right medications in. So there's a whole host of factors that contribute to chronic asthma, unfortunately. So we're trying to improve that, one patient at a time. Absolutely.
Yeah, yeah, no easy fix, and as you said, it's
Sure.
multifactorial.
Yeah.
In your practice, do you ever spend any time on things like motivational interviewing to try to help address individual non-adherence with medication and things like that?
Yeah, absolutely. I think I try and make it a point. As I mentioned, we try and spend more time with our patients. I spend at least 5 or 10 minutes on just the medication aspect
Hmm.
and telling patients, what the medication options are, teaching them how to use their medication, and then having, my staff teach the medications also. So at least twice they're doing it. And sometimes I even write, for the pharmacy to teach the medications. So, like how to use inhalers, things like that, for example. So I just try and spend as much time, with the patient, answering questions. It's interesting. I had one patient that they just didn't like the term asthma. They're like, okay, Dr. Nanda, I know I have asthma. I just don't like the term, and so their asthma was predominantly cough. It presented as a cough, and so I said, okay, instead of calling it asthma, let's just call it a cough with inflammation, and this patient was happy with that and said, okay, that's fine. I'm fine to take I'm gonna call it a cough medicine that you're giving you, not an asthma medication. So just an example. There's different ways of, again, we're individualizing everything, different ways of talking to our patients. So
Hmm.
for sure. Mhm.
No, I like that. One thing that I always like to do is basically tell people it's normal for them to use their medicine about half the time,
Sure.
and it just kind of
Yeah,
sets that
exactly.
bar,
Exactly.
and because
Sure.
everybody wants,
Sure.
nobody wants to go in and say, "Hey, doc, I've only used my inhaler 3 times in the past week" or anything like that. But if we say,
Sure.
"Hey, it's okay. There's a lot of challenges in life, and it's not easy to do this stuff," it just kind of makes everybody feel a little more at ease.
No, absolutely. And people are uncomfortable seeing physicians. That's why we try and, make patients as comfortable. I'm uncomfortable seeing my own physician, we physicians are not the greatest patients, so it's very important just to kind of make patients feel comfortable. Understand we're both human, we're both human. We don't expect perfection at all. But if there's any concerns or anything, we're available for our patients. Absolutely.
Yeah, and I think this is an important conversation for many reasons, but it helps us too. Like we need because we're trying to do is help our patients achieve optimal
Sure.
outcomes. And if it's they're using their medication as prescribed and they're still not better, that takes us down a different path, right? Because then we may need to increase the dose or try different medications. But if it's simply that they're not receiving the medication as consistently as we thought they were, then maybe we focus on that instead. And as you said, we don't want to just push medication and drugs on people. We really want to,
Sure.
take a holistic approach to make them feel better.
Yeah, absolutely. And I think one thing, just to remind our general public, there's not one test that says, yes,
Mm.
you have asthma, no, you don't. I have a lot of patients come in and they're like, hey, I want to test for asthma. And a lot of times, asthma is basically what we call a clinically diagnosed condition. It's a physician diagnosed condition. And we look at different factors. Yes, there are tests, allergy tests, lung testing we can do to kind of help assist us in making the diagnosis. But definitely, I think it's important, just to realize that there's not just one test for asthma. And it just, again, highlights the importance of seeing an asthma specialist, like an allergist immunologist, so you can have a very confident diagnosis of asthma. Absolutely.
Hmm. Now, you mentioned a word a few minutes ago that I want to go back to, if we may, inequities. And,
Yeah,
rightfully so, there's been a recent spotlight, especially during the pandemic, on how inequities
sure.
impact various health conditions. So, what do we know about how inequities impact asthma?
Yeah, a lot of times, there's historically, marginalized, disadvantaged, underserved populations worldwide, and of course, here in the United States, and it's a big issue. We know that certain patient populations get more asthma therapies than others, and it's something we're trying to do, not only in my practice and in my kind of in the microscopic in my practice, just to kind of help that, but also systemically, I think just improve that. That's with our allergy organizations and medical organizations, things like that. But we know that for certain historically marginalized or historically minority populations, they've more significant asthma, more fatal asthma, more hospitalizations, things like that. And I think that's something we're trying to address and trying to get improve healthcare for everybody. Absolutely, it's very, very important, and it's not going to be solved overnight. But I think
Mm-hmm.
we're trying, on a organized medication, medical basis from medical school on up, and then in our various practices also. So it's important to consider, and we're trying. I think things will improve, especially with all the work a lot of the great physicians are doing across the country. Yeah.
Hmm. Misinformation has gained a lot of attention in recent years, especially during the pandemic. However, with asthma, there's always been these misconceptions, and you sort of touched upon several of these already, both from healthcare professionals and from patients. Do you have any favorite myths or misconceptions that you'd like to set the record straight on today? If not, I have some that I'd like to throw at you.
Yeah, no, absolutely. There's so much, and it's one of the ways, I mean, first of all, social media is here to stay. Okay, social media is not going anywhere. We all like our, kind of funny TikTok videos and Instagram and people we follow and Facebook and all this kind of stuff. But I think first of all, the one thing is if you see a post online, don't assume it's factual. I think that's number one. If you see someone talking about asthma, not sure of their credentials or if they're a physician or if they're a specialist in asthma or whoever, just kind of definitely talk to your own physician first, and specifically, I say allergist, immunologist, specialist about any questions you have about asthma instead of just running to social media,
Mhm.
and ask them about a social media post. Show the physician the social media post. I think there's billions of posts every day, probably multi-billions probably. And so, we haven't seen all of them or even a small portion of them. So definitely show us. I've had patients come and show us, say, hey, this person said this, or let me show you this post. Is it true? And then we can have a great discussion on that, on if it's true or not, so I think it's definitely very important. One thing I see, is kind of the albuterol medication. It's kind of what we call a bronchodilator. It kind of opens up the lungs temporarily, but it doesn't have a lot of anti-inflammatory activity associated with it, right? So a lot of times it's like water. Everyone has as an albuterol inhaler, and they're like, hey, this is treating my asthma. And it's only partially true. It's treating kind of as needed, kind of temporarily treating your asthma, but it's not giving you the controller therapy that you need. So that's just one thing that I think that's out there that we're trying to kind of combat. But yeah, I'd love to hear some of yours.
All right. Well, I hear quite
Yeah.
frequently that people are afraid to use inhaled corticosteroids because they don't want to become addicted to them. So is that something that can
Correct.
happen?
That no, it's not. No, there's no addiction potential to that at all. And again, it's the same thing. When they talk about inhaled corticosteroids, they're like, well, oh, it's the same thing as the steroid pills and the steroid injections, which are much much higher doses, and they're not. It's a much microscopic dose compared to those higher dose ones. So again, all steroids are not the same. So that's very important. But yeah.
Yeah. And what about your patients that come to you and say that it's okay, they're allergic to cats or dogs, but they got one that's hypoallergenic?
Yeah, that's the thing. I mean, there's probably no such thing as a hypoallergenic cat or dog. Unfortunately, I know it's a big marketing thing nowadays,
Yeah.
and it's kind of like the cosmetics or whatever, deodorant lines, anything. Everything is hypoallergenic, but there's always some chemicals in there that are allergic. But in the pet case in particular, the cat allergen, dog allergen, it's found in the saliva, on their skin. in the urine, that's true. In the hair it is. And let's say, you shave the dog or you bathe the cat, that can help reduce the allergen, but it won't eliminate it. And again, try bathing your cat on a frequent basis, and good luck with that. No one, so
No, exactly. Well, let's combine this, if I may, with something we talked about before, and that article I mentioned about all those very expensive products that are out there. So, what's sort of one of
sure.
the craziest products that you've had a patient ask you about, or that you saw online that was touted to treat asthma, but as immediately looking at it, that it's not validated and there's no evidence to support that. Can anything come to mind?
Yeah, I think there was one like air purifier that kind of sparks electricity and has, it kind of looks like, I don't know, this it's something I've seen like in physics class or something, right? Where it just kind of, it's almost like lightning forms, and it's this
What?
ball and kind of has this kind of lightning, and it's supposed to have ionizing energy to reduce all the allergens. And it really, there's no evidence that it did anything, and it's just very interesting. It was just nothing. So I told my patient, I'm like, there's no evidence that this is going to work, and you're better off, spending your money elsewhere, than that, thousands of dollars on something that's just touted as this cure all. And that's the one thing, just to, let our general public know, if something sounds too good to be true, or someone's marketing something as a cure, it probably is. It's probably too good to be true. And again, there's no such thing as a cure. So just be aware of that, definitely when looking at things. And again, comes back to it. You look at something that's marketed, ask your physician, ask your allergist
Mhm.
immunologist about it. Absolutely.
No, I love that. I just like to very quickly pop the bubble on Himalayan salt lamps. Have you seen this? You can buy them
I've
at many
seen it.
different
Yes, I
retailers.
have. Yeah, yeah, yeah,
Those also do not
absolutely.
treat asthma. Yeah.
Yeah,
Um,
there's everything.
well, we talked about how these disease awareness months and asthma awareness month, it's a time for advocacy as well. What are some of the ways that you've been involved in advocacy throughout your career, and how should we think about that during asthma awareness month?
Yeah, no, definitely. I think advocacy is something I've become more and more involved in over the years. Just when I'm here in Texas, so we had what's called a First Tuesday, which are basically 4 Tuesdays a month where we go to our state Congress, or state legislator in Austin, the capital of Texas. And so we wear our white coats as physicians, and we go and we kind of talk to the state representatives and state senators about different things that impact medicine. For example, having asthma medications or other medications covered by the insurance companies. Definitely increasing awareness about asthma and other medical conditions, other allergic conditions like food allergy and things. So definitely, we advocate for our patients, and to really help our patients out. So that's one thing. And just you can write your congress for your state senator, representative, or even your U.S. senator and representative. You can write to them. You can email them about different things that concern you. Just in the general public, that's what they're there for. That's what our government representatives are there for, to represent you. We're all the constituents. So that's something that's I think anyone can do, and anyone can be an advocate. Absolutely. So it's very, very important. And I think just the basic thing, with Asthma Awareness Month, you touched on biologic therapies or other therapies, and there's something called prior authorizations. It's very interesting. Basically, as physicians, right, when we write a prescription for a medication, we've authorized it. Like, it's all good from our end. The thing is that medication going to be covered by the insurance company? And the insurance companies a lot of times needs basic evidence or proof that the medication is needed. So a lot of times, we're caught in the struggle because we just have to, we have to send notes over to the insurance company and things to prove that the patient needs the medication. And then the patient doesn't have the medication because it's not approved. And so it's an issue, it's an issue that can have very detrimental effects. And so we're trying to improve that, and trying to, kind of called prior authorization. So we're trying to get that, at least give that to the attention, get that to the attention of our state and the United States, federal government, so they can improve things. And we're working on it. There's some bills and laws that have been passed to kind of improve that, but we're trying to improve it further so our patients get their medications that are needed. Absolutely.
Well, what advice do you have for either patients or the general public or our colleagues, medical professionals who want to get more involved in advocacy but might not know where to start? Where did you get
Yeah,
started or any practical tips?
absolutely, absolutely. I got started actually. My county medical society actually was very important, and so my county. I met with my county representative, Texas state representative through my Denton County Medical Society, which is just my local county society. So that's very helpful. Your state medical societies are very helpful. So I think even our allergy societies, are very helpful. So your specialty societies. And I think from the patient's perspective, absolutely. I mean, I think talking to your local state, senator, state representative, because we all have them. They're all in our districts, right? Whatever district you're in, anywhere in the U.S., you have a state representative, a state senator. You have a United States federal representative, United States, federal senator. So I think getting in touch and just even as emailing and things is a great thing. We talk about social media and internet and some of the negatives. These are some of the positives. We have access. We can even on social media, send our congressman or congresswoman, congressperson, any kind of issues that we're having, things like that. Talk to the staff. You can even call them directly. Call the offices directly and get started. So it's something that anyone can do, and that's what I've learned. I remember, I had civics, government things in sixth grade, and then I'm out here as a physician. I haven't gotten exposed to a lot. Where do I start? And I just kind of the same thing. Just asked around, kind of started again for my medical society, and I realized they're like, hey, you can just email your state senator and representative about things that are issues that that are very important to you, and get started that way. So it's something anyone listening to this can do, and I encourage them to do that. I think it's great.
No, I really like that you touched upon that. And I'll just add one thing if I may. And I know you do a lot of
Sure,
media interviews as well. And it's one thing whenever you and I, give a media interview, we get quoted a couple of times, but every single story you see about health or healthcare, there's always a patient testimonial included. And reporters and
sure.
journalists really want to talk to patients because that's the emotional story that really gets people motivated. So I would say for those out there that are motivated, get involved, reach out to your local elected officials, or like you said, beyond that, and get your story out there because I think that's how change occurs. So yeah, thanks for mentioning that.
Yeah, no, absolutely, absolutely.
Dr. Nando, what do you enjoy most about taking care of patients? Is there anything in particular that you find rewarding having a career as an allergist? I think your passion comes through as I speak with you, but I'd love to hear if you can sort of elucidate that for us.
Yeah, no, absolutely. I mean, it's just such a rewarding field in terms of taking care of patients. Emotionally, when you see patients get better, it's just great. I mean, there's a lot of paperwork and things and all of that, and just like in any other field. But it's just great seeing your patients get better, seeing them come in. For example, with asthma, seeing them with asthma that's uncontrolled, not diagnosed, and at least to give them a diagnosis, treat the asthma, follow up on them. And they get better, and they're able to do their activities again, or they've realized that, hey, I've had asthma, and I thought it was very well controlled. I thought I was okay, and I'm able to enjoy life so much more now. I was just kind of coasting, in the past kind of thing, and now they're able to do so many more activities, and I think it's just wonderful. And I think as an allergist immunologist, we see patients of all ages, so it's almost like what our family physician colleagues get to do is I see the whole families. I see the grandparents, the parents, the children, and I get to see my patients grow up into adulthood, and it's really a wonderful experience. So I'm very thankful, very blessed for what I do. Absolutely.
Well, it sure sounds like you enjoy it.
Yeah, no, it's great. I can't imagine doing anything else. So it's really great, and I learned so much from my patients. They've been really amazing, and really they've taught me a lot. And I think that's the one thing with, patients don't seem to realize, and the public doesn't seem to realize that they teach us so much. Not
Hmm.
just in their about healthcare and things, about their medical condition, but just everything. I get better talking to people. Just seeing patients and different patients. I'm much better at talking with people and kind of understanding people a lot better. So I think it's just important to realize we're all humans here. We all have strengths and weaknesses, and so it's just a joy taking care of patients and doing what I do. Absolutely.
Mhm. Well, as I stalked you to get some background info for today's conversation, I saw on your practice's website that it states that you, and I'll quote, strive to answer patient questions personally and discuss all testing results personally with patients, end quote. Are you really able to do that? And if so, I have follow-up questions such as how do you find the time and why do you find that so important?
Yeah, absolutely. I think it's so important because, a lot of times, and again, we're all colleagues. All of us in healthcare are colleagues and things, and it's just one of those where I like to do things personally, because it just makes a difference. It's just spending extra time with patients, and going over the results. A lot of times, if someone else who's not a physician, and again, I get it. Every practice is different things, but what I found is if someone's not a physician talking to patients about test results, for example, patients usually have questions.
Hmm.
And then that person who's not as trained, is not a specialist, is like, okay, can't answer the questions as well. So that's why I always like to answer patients' questions thoroughly and discuss their test results and say if there are any questions. And you know how it is. A lot of times, we go in, as me as a patient, I go in and ask a doctor a question, and then I'm like, I leave the office. I'm like, wait, I forgot to ask the doctor that other question, or the other questions come up. And I say, hey, call us if there's any other questions. That's what we're here for. That's why I went to medical school. It's to help people and help them with their condition. So the way I'm able to do that, and again, I'm very thankful. But I have my own practice. So I have my own practice. I own my own practice. And so I'm able to kind of set the schedule my way. And again, every practice is different, and every physician is different. There's so many pros and cons to everything. But I have my own practice, and I have my staff, of course, helping me out. But I'm able to say, okay, I'm able to put 1 hour for new patients, as opposed to some places where they're just, for 30, 45 minutes for a new patient. But I like to put extra time. And then, sometimes, as we all know, right, we go to the physician's office and they're kind of running behind, things like that. What helps me is I try, if I'm running behind in things, I actually go out to my waiting room personally and tell the patient, hey, I'm so sorry I'm running behind. I'm just going to be 2 or 3 more minutes, and usually patients, they really appreciate that. The hard part is when you're a patient in an office and no one tells you anything. You're just, not sure, when you're waiting, you're like, wait, why are they late? Things like that. It's communication, and that's something that a lot of us were taught in medical school, right? Way back when, but sometimes we forget it. I understand we're under different pressures and things, but just the fact that I have my own practice, I'm able to kind of set my own schedule, which is great. So I'm able to spend more time with my patients. So very thankful for that. Yeah.
Mm. Well, I appreciate you discussing that. And when I saw that, it struck me because I'm the same way. I call all of my patients back myself
Sure.
because I agree with you. They always have follow-up
Yeah.
questions, and I like to explain things. So do you actually make phone calls, or is it some online portal that you use, a combination of both? And do you schedule time in each day to carve out to do this?
Sure, absolutely. Yeah, yeah. Usually it's a little bit of both. Usually just personal phone call. I still kind of, and I guess maybe it's my age. I guess I'm a little more old fashioned. Rather than just an email or a text or anything like that. A lot of times a phone call is better because you're actually talking with the patient live. They can answer more questions. It's a little more personal that I found. At least. I know we all text and things and email, and that's great. But a lot of times, if it's about a healthcare issue or some questions and things that they have, the phone call really helps, and we can answer all their questions. So rather than getting a text and then a follow-up text and like 6 or 7 follow-up emails, I can answer their questions in a shorter amount of time by a quick phone call. And that's a lot easier for me. So again, I just want to thank all my patients. That's
Well, as we kind of close out our conversation, I think this is great. We really covered a lot of ground here. I generally like to ask many of our expert guests to make predictions. Well, of course, I'm not going to hold anybody accountable for something that may not come true, but we'll never know, or at least we won't know for the immediate future. But
Bring
if
it
I
on.
had,
Hold me accountable, Dave. Hold me accountable, Dave.
all
Why
right,
not?
you know what, we'll revisit then if you get this wrong. No. So, what do you predict will be the next major breakthrough in either the diagnosis or management of asthma in the next 10 years?
I think new medications. There's new medications coming out, and we're kind of striving for this, in that in the realm of, again, one size doesn't fit all. We're kind of striving toward precision medicine, basically individualized approaches. And so hopefully, I'm thinking maybe in the next 10 years there may be something where you can have even genetic markers. You can have a patient's kind of DNA genetics and say, okay, well, based on their genetics we kind of look at, okay, maybe they're going to be better for this type of therapy for their asthma as opposed to this type of therapy. We're not there yet, but I'm hoping that's something I think that potentially doable in the future. And I think again, the other one we talked about, inequities in asthma, we hope to improve that. And I think the work that we're doing with just individual, on the individual physician level, to the state level, to government, to our medical society level, including the Quad AI, I think we're going to improve on helping reduce the disparities and inequities with asthma and other allergy and medical condition care. Absolutely. So.
Okay, well, we'll revisit in the year 2033 and we'll see if any of this comes
Yeah,
true. How about
absolutely. Absolutely. Yeah, we'll schedule the next podcast right now. I'm ready.
that?
for,
What, I mean,
for 10
at,
years.
at least you didn't predict that we'd have, Himalayan salt lamps to treat everybody with asthma.
Yeah, exactly. They'll still be around. There's going to be the next generation of Himalayan salt lamps coming up. So, so again, that'll never change. Talk to your physician, talk to your allergy immunology specialist. We'll still be around. In 10 years and in time and stuff. And definitely we're here to help. So absolutely.
Well, all right. So then the last question is sort of a three-parter, if I may.
Sure.
And if you could have, say, one mass text message. So I know you don't like to text a lot, but instead of calling everybody, if you could just send one mass message to everybody
Sure. A
in the
tweet. We'll tweet it out, right?
okay, there you go. So that does exist. There you go. You can tweet it out. So let's target the general public and people who don't actually personally have asthma. What would you say to them and why?
I would probably say just be aware of asthma. Be aware of it. Because if you don't have asthma, chances are, we said at the beginning of the podcast, about what, 26 million approximately, Americans or, in the U.S. have asthma. 26 million people in the United States have asthma. So if you don't have asthma, you either know a friend who has it, a coworker, a family member. Definitely just be aware of it. And next time, someone's having a cough or any, family member, or you hear them wheezing and they say, hey, I'm fine, I'm breathing okay, it's not asthma. Just think about it. Ask them to see their allergy immunology specialist, because we're happy to help out. And definitely just be aware. Absolutely.
Okay, that's very fitting given that it's Asthma Awareness Month. I like that.
Sure.
So let's take a similar approach, and you can have one message or tweet or whatever you want it to be to the millions of children and adults who do have asthma. What would you say to them and why?
Yeah, definitely. I say first see your allergy immunology specialist, because we're experts in asthma, and I think that's very important. And the next is don't sit on it, so to speak. Don't ignore it. I would get medical attention. I know we're all busy. Kids have school, adults, as adults we're all busy and things, but definitely make time for yourself. A lot of times, and we see this a lot, right? Everyone's trying to take care of the parents. The parents are trying to take care of everyone in the family but themselves,
Hmm.
and they put everyone else first. And that's great. That's very noble, of course. But take care of yourself. I'd probably say take care of yourself. See your allergy immunology specialist, your physician. Take care of yourself, absolutely, and definitely. to improve things. And again, as I mentioned, bring in all your medications to the office visit. That'll help us as physicians so much. So please don't assume that we know everything, or I'm taking the blue pill or I have the red inhaler, because these companies, they change all the colors of the of all the medications all the time. So bring in everything to your physician. Really help us out. Appreciate that.
Well, I think you may have exceeded the 280 character limit that Twitter allows with that last one, but I
Yeah,
think
I think so.
we'll
Yeah,
allow it.
exactly. I know. So I still I still have work to do on my social media expertise. Yeah, exactly. So maybe I'll do a reel on an Instagram or something, or a TikTok video about that or something. So
Well, there you go. All right.
like 3 or 4 series of TikTok.
Okay, so lastly, what message would you send to our colleagues, to healthcare professionals who treat patients with asthma? What would you say to them and why?
I say thank you. I think a lot of times a lot of us physicians and other healthcare, we're all a big team, right? We physician assistants, and nurse practitioners, our staff, medical assistants, everyone. They work so hard to help all our patients. So I just want to say thank you, and appreciate all the work you're doing, and it's really 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 great. So again, thank you.
Yeah. Well, with that, I'd like to thank you for taking the time to be with us today. I think that this was extremely insightful, and you offered a lot of great information for people to consider out there. Is there anything else that you'd like to add before we depart?
No, I think just one, maybe a plug for our Quad AI, our quadai.org, website. We have a lot of great information for patients and things, and especially in all things asthma. So definitely, I think just get more involved and follow us. Get involved with our website. Check out our website at quadai.org, and really really happy to help out. Appreciate that.
Yeah. Well, thank you again.
All right. Thank you so much, Dave. Appreciate it. Be safe, everyone.
We hope you enjoyed listening to today's episode. Please visit www.aaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Google Podcasts, or Spotify so you can receive new episodes in the future. Thank you again for listening.